My name is Sylvie Lambert. I'm assistant professor at the School of Nursing at McGill University and a research associate with St. Mary's Hospital. There's three main study results from the research that we conducted with cancer caregivers. The first thing is that caregivers in our study had more anxiety than the patients themselves, which we were surprised about. They had comparable levels of depression, but definitely more anxiety than the patients. The second key finding is that caregivers that experience anxiety early on in the illness trajectory, so at 6 months, remain anxious or remain depressed up to 5 years post-diagnosis. And in both cases, we're talking about a third of the caregivers that do not resolve, that their anxiety or depression does not get resolved spontaneously. And the third key finding is that we identified some variables that we can change, that we can intervene on to help our caregivers. So one of these is providing emotional and social support, helping them in their coping skills, as well as their physical health. So caregivers with lower physical health had higher levels of anxiety and depression. So these are all variables that we as healthcare professionals can then devise intervention to try to intervene and help our caregivers. I think the latter, the point that I feel most strongly about is our ability to intervene and have services available for caregivers. And I think in the current cost containment climate is trying to use innovative modes of delivery to be able to deliver the information and deliver to the support to caregivers in a way that is sustainable and cost effective. So we're using different delivery formats such as manual-based or workbook-based interventions, as well as delivering information online. But obviously it's not accessible to every caregiver because of health literacy issues, for instance. So we're really working on trying to make the information that caregivers need, the support that they need at a time and place when they need it the most through some of these alternative formats to the face-to-face mode of delivery. For cancer nursing, the implications of the study mainly are at the assessment level, recognizing potentially that not only do patients need to have their distress or their anxiety or depression screened for, so do caregivers. And there are some of the measures that we use for patients, such as the distress thermometer, are also applicable to caregivers. So I think if a nurse or other healthcare professional notices that the patient often comes in with a caregiver, it's potentially being able to give them these tools to see, so we can assess if the caregiver has a high level of anxiety or depression. Based on our findings, we know that this will not go away on its own, that we need to connect them to some of the services that are potentially available. And the second implication, I believe, is on the intervention side, in terms of disseminating the information that, some online interventions are potentially available, or even I saw the Irish Cancer Society have a number of services that family and caregivers can use. So the other implication is often that caregivers don't know that these services are actually available to them. And particularly, I was at another presentation by the Irish Cancer Society, and some of the non-traditional or more innovative services, they have a lot of those available. So both in terms of assessment and in terms of dissemination potential intervention strategies. Having presentations on the impact of cancer on carers, I think, is really critical, and I applaud the EON's initiative, especially in today's context when we know that cancer care burden is no longer manageable by formal healthcare settings. So there's a shift towards community-based care, and in that context, caregivers take on the majority of patients' care. We know it has cost savings for the healthcare system. We also know it has an impact on the patient's outcomes. We know that patients that have informal caregivers helping them with their care, whether it's coordinating their care, whether it's with practical support, whether it's with medication, do better. than those that don't have an informal caregiver. So that's the important link. So I saw there was a few other presentations on care, so I am looking forward to connecting with international colleagues and also sharing some of the interventions that we've started. And I know there's some colleagues that are looking to potentially look at the interventions that we've developed and adapting it to their settings. And I think it goes back to what the keynote said this morning. It's all about global initiatives to win the fight against cancer. And I think this is an example where we might develop an intervention in one context, but some of the issues above and beyond being in a specific country are really much broader than that, and some of our interventions might be applicable. So we don't reinvent the wheel, but we're actually able to make leaps and bounds forward because we already have a base that someone else worked on, and learn from their experience, their research, and then go to the next step. So for me, that's what's most exciting about this conference.